I think what sets us apart from other facilities is really a couple of things. One is we do things endoscopic, which is not totally unique, but it is much less invasive than open lumbar spine surgery. But also secondarily, I've heard other people come in from other facilities that say that they're not treated on a personal level, where I feel here at the Bonati Institute with each patient we deal with as an individual. We spend time with them. I am the first medical exposure the patient has to the Bonati Institute, so I do try to educate the patient for what we do here surgically and their expectations from their visit here. My usual visit with a patient is around 45 to 50 minutes. And when I see a patient, I explain to them, first of all, who I am, what we do, and I get a detailed history from the patient, basically length of time they've had discomfort, specific location of their discomfort, whether they have any associated symptoms of numbness, tingling, and/or weakness associated with their pain. I also do an extensive physical examination, which includes motor strength testing, sensory testing, along with describing actual nerve locations and where that pain is usually distributed. After obtaining the history and the physical, which also includes what they've had done previously, because some patients have had previous lumbar surgeries, any conservative measures that they've had, I go into an explanation of what we do surgically. When I explain our surgical procedures, because we are limited on what we do arthroscopically, because we can only do one side and one level when we do our surgeries, I will explain that to the patient in this way. Usually we will make an incision about an inch. It's a lateral incision, and we will come in to the area that we are going to operate. And obviously, because we work through a 16 millimeter tube, we can angle up a little bit, we can angle down a little bit. But our limitations with that surgery is we cannot get up a level and/or down a level. The other issue, if the patient has symptoms on both legs in this particular case, we can only do one side. In this example would be the right side. The second surgery, the left side, would be a standalone surgical procedure in itself. And once I explain to that, what I do basically is I will show on a diagram of what we do surgically. And this is a slice, an example of a slice of an MRI of the lumbar spine. What we will do is I explain that we make a lateral incision here, and we will come in to the nerve that we're going to work on. And then if the disc is associated with any of the disease or pathology, we would work on the disc. So the whole goal of the surgery is to take pressure off the nerve, and the way we do that is we do it arthroscopically, 16 millimeter tube by removing bone, which will inherently open up the foramen, and if the disc is on the nerve, we would work on the disc also.